Days of demonstrations against racial inequality, concern about the spread of COVID-19 moves beyond the protesters. Medical reporter Liz Bonas shares why public health experts are also recommending testing for those who had to police them.
As demonstrators and protesters gathered around the country and here in Ohio's Cincinnati area, public health specialists started sounding the alarm about the potential spread of COVID-19.
I think it's inevitable. I mean, the virus is still out there in the community. We're still seeing cases, and with more people getting out and interacting without masks in place, I think we're going to see more cases.
That concern, however, going beyond the crowds to those protecting them.
I want to applaud our police department because I thought they did a great job and a lot of discipline compared to some other cities. If I put my public hat on, what a disaster. What a disaster. People in the street without masks. I worry.
Dr. Odell Owens, not the only one concerned about police officers here and across the country.
We're very aware of the risks of COVID-19 and trying not to expose ourselves, but certainly there's times where it's just almost impossible not to have close contact with the public.
Lieutenant Steve Saunders and Sergeant Eric Frank told me many of the teams protecting against violence had to give up some of their own protections against the coronavirus.
We've made steps in the beginning to separate our officers into single-person cars, and now we're back to double-person units.
Now, after days of close contact, the true risk of catching the coronavirus a real concern.
35% of people don't have symptoms, but they're carriers.
The recommendation of testing and watching for symptoms for those who gathered, now extending to those who served.
We've asked our officers if they have any symptoms at all to report that to us, and if they want to get tested, we'll get them tested. But we do temperature tests every single day as officers come into work. We ask them to even take their temperature before they come to work.
Lieutenant Saunders says since the pandemic started, just shy of a dozen of his officers have had confirmed cases of COVID-19. They'd like to keep it that way.
We've jumped through a lot of hurdles, as most departments have throughout the country.
Hurdles that now go beyond public safety to the safety and health of those who continue to protect and serve, even in a pandemic. I'm medical reporter Liz Bonas reporting.